You're scared to death. You're looking for somebody to tell you what to do.
I'm hearing information for the first time, and a lot of it.
I'm not even going to pretend it was very difficult for me.
And I have to understand it, be able to make choices.
You're in a fog for a while when you get diagnosed.
It's like white noise, right? You can't think about anything else except for the diagnosis and how you're going to get through the diagnosis.
You feel like you're to blame.
I knew something was, even though she said, I didn't feel it, I don't understand what you're saying, I know something was wrong.
You feel like you have this dirty thing inside of you and you just want it out immediately.
You feel alienated from other people, particularly at work when you have to continue with your wig and your no breasts and your instant menopause and all of those lovely things.
You feel like this is an invading force inside your body. You want to get it out. And then we'll talk about what the options are down the road.
I saw at least 10 plastic surgeons. I made appointments and I see them. And my insurance wasn't covering all of them, so I had to pay out of pocket. But for my own good, I needed to do this.
I was thinking, do I want to have those implants? But no one ever said don't get them. No, that's like what you do, right? When you need reconstruction, you have implants. Little do you know. The recommendation was to have implants, and then I was given a choice as to having saline versus silicone. And I thought that the saline was safer. They didn't really have much information about the silicone to provide me. So I went with my own, judgment, and I felt that the saline was safer.
Elizabeth, when she came to me, she had had her reconstruction, I want to say it was like 11 years earlier or so, but it was quite a bit earlier. She had implant reconstruction. I think she was radiated on one side.
I had the saline implants, and I had chemotherapy, and then in the fall, I had radiation. Initially, everything felt fine, but as years passed, the left side, where I had the radiation, started to become very hardened and uncomfortable, and I had another surgery, and we changed both implants. And he said, wow, you had a lot of scar tissue in there. He had no idea.
She had very bad cording and capsular contracture, especially on one side. I mean, you could literally see the cord across her breast.
She was very open, and she was very, just honest about all of the things that I had gone through and my options.
When someone comes to see us, it's really about giving them all of the information that we can so that they can make the best decision for themselves. And sometimes that means no surgery or surgery with somebody else. But that's okay as long as they're comfortable. So I think that our focus is always on making sure the patient feels comfortable and confident with her surgeon, and knowing that we're going to take care of everything else.
I didn't feel pressured into anything. She explained the procedure that she would do. She takes the tissue from your belly and she transports it to your breast and creates your flaps from your own tissue. But she didn't just explain that. She also said, you can have another surgery and change the implants and go that route.
At first, she was going to undergo flap reconstruction, but then she thought, it's too big of an operation. I have kids. I'm responsible for everyone in my family, which is another big thing. Women are often the caretakers, so they're reluctant to undergo what they perceive as a much bigger operation. And frankly, it is a bigger operation, but they see it as like so much bigger that it's not fair to the people around them. So they opt for what they think is going to be easier on the people around them because they're caretakers.
And then I said, well, if I have this surgery done where I'm using my own tissue, maybe I won't have to have another surgery in 10 years.
I did deep flat breast reconstruction, and she definitely felt better afterward, which it's no surprise when you take a foreign body out from underneath a muscle where it was never meant to be, and you replace it with natural tissue where the breast used to be. They usually do look better, but aside from that, what everybody says is, this is like before my mastectomy.
It looked fine, but it felt like my skin again. It felt like me. It felt soft.
I was diagnosed with breast cancer, and I went through the route of talking to doctors, and the only thing I could get were implants at the time. So I went ahead and had a double mastectomy, had implants put in, and for 7 years I was in so much pain, and my whole posture started to change. Like, I was bent forward and my neck was thrust like this, and then I started getting shooting pains down my arms. And I kept going back to my original doctor, explaining what was going on, and he said to me that it's the luck of the draw, Kate. He said, you know, some women, you know, have issues with implants, and some women don't. And these are the cards that you drew, and you got to live with it.
The most common reasons for implant problems are capsular contracture, which is basically scar tissue that forms around the implant, infection, because the implant does not have a blood supply, and rupture. So capsular contracture, the implant is a foreign body, so the body tries to protect itself from the foreign body by walling itself off with a capsule. Every single implant that goes in will have a capsule. It can range from something that is soft and you cannot feel it, it's just kind of filmy, you don't even notice it, to something that becomes hard and painful and even calcified over time, literally hard as a rock, and it can be very, very uncomfortable for people.
Basically what had happened was the scar tissue had just, I forget the name of it, encapsulated, but they just had like cemented onto my chest. And it was affecting everything, the muscles, the tissues, the nerves.
There's another type of reconstruction, and that's using your own tissue, natural tissue breast reconstruction. It's a bigger operation. You have scars at the donor site. It's just a bigger, more complex operation, but you use your own tissue to create breasts that are soft and warm and natural.
She immediately recognized what was going on, said that she'd actually seen a patient the week before who had had the same doctor as me, and said that she could take my own tissue and build breasts for me. And I couldn't believe it. I said, what about, you know, with implants, I don't know if a lot of people know this, but they're not the same temperature as your body. And that was one thing that really bothered me about them. And so she said, oh, you know, it'll be your own tissue. It'll be the same temperature as the rest of your body. I'll also do a nerve graft so that you'll get sensation back in your breasts. I also will build nipples for you because I did not have a nipple sparing. And at the same time, you get the benefit of having a thigh lift. I was like, okay, we're in.
When I saw Dr. Chen, I was very adamant that I wanted implants.
It was just something she was familiar with, and that's what she wanted. But she was referred to me specifically for flaps. She was if you come see me, you're gonna know all about flaps, you know? And she definitely heard everything I had to say about implants, and she still wanted implants.
She said that there was a high risk of infection, and that you know, it was not, you did not have your own blood flow any longer in your breasts, and that it works out great for some people, and some people it doesn't. Since I did not have radiation, I was still relatively young. You know, I was at a good position to do so, but she did inform me about that. I wouldn't say it fully registered because I thought, well, that, you know, that's like all the warnings that you hear on pill bottles or things like that. But I didn't really consider that what would happen would happen.
She did fine with the implants for years, poo-pooed people who had problems with implants, and then she ended up with a problem with an implant.
Because I went into a hot tub, despite Dr. Chen telling me you need another 6 months before you can go into a hot tub. And I went to my parents' hot tub, which I thought wasn't like I went to a public one, but I got cellulitis and an infection. I thought, oh, I just have a little bit of a cold. And then all of a sudden this thing erupted, and it necessitated basically emergency surgery. I was in the ICU for about 10 days, and it was a very bad infection. So if I had not been pushed to go to the doctor, I probably would not be here.
We were going to try again with implants, because she was someone who I thought never in a million years is she ever going to want flaps, because she was given that option and she's reminded of it every time she sees her breast surgeon, and she's proud of her implants.
After the implants came out, being without anything was very thought-provoking. And I actually felt better physically without them. Mentally, not at all. But physically I went, oh, well, when I exercise and do things, I don't have these implants, and everything felt a little bit better. And I think that's what kind of started me thinking, maybe there's another way that offers more comfort.
She said, what was that other option you guys were talking to me again, that flap thing? And I was like, oh, I was so surprised that she brought it up. And she asked me, well, all I want to know is it going to look as good as my implants? And I said to her, oh, there are a lot of things to worry about with flaps, but appearance is not one of them. The best implant and the best flaps, they're just not in the same league.
Going back and doing the deep flap, there was a lot of difficulty. I had to go and have my veins mapped and all kinds of CAT scans and things like that brought me to tears. It's not easy. It's easier to get implants, but my breasts were great. They were warm, they looked great, they looked natural. I mean, you would really have to look hard to even know that I had any surgery at all. They move, when I move. They're part of my body, and it feels great.
I was really looking for a way to use natural tissue. I had somehow heard about it in this whole process and fog of being diagnosed with breast cancer. I just never really considered ever having implants outside of breast cancer, and I just felt that that was the way that I wanted to go, but I wasn't able to do that simply because several doctors had diagnosed me and said that I didn't have enough body fat to do that.
If a thin woman comes to me and asks for breast reconstruction, I tell her the same thing that I tell every other human being that comes in for breast reconstruction, that there are two options. And often I will hear people say, I've been told I don't have enough tissue to undergo natural tissue breast reconstruction. My only option is implants. And I have yet to meet somebody whose only option was implants. I am known for doing natural tissue breast reconstruction on thin women.
Once I realized that there was an alternative, that Dr. Chen could find the fat, there was no question in my mind, a little question in my mind, because I had a whole other team ready to go. And that I really loved my surgeon. And I had a whole nother team ready to go, but this was really a last minute kind of thing. And I just didn't feel comfortable, and so I had to, make some difficult decisions.
The gold standard is certainly going to be natural tissue breast reconstruction. It's going to give you the most natural result. You're going to have soft, warm breasts. They're going to last forever. It's going to feel the best. It's going to look the best. It is a bigger operation. So you can't force someone who wants breast reconstruction to undergo an operation they're just not prepared to have.
When I had my original mastectomy, one of the options that was offered to me was, I forget what it was called, another type of flap surgery, where they took the muscle, trap flap, right, and they moved the muscle from the abdomen up to the breast or from the back around to the breast, and that just sounded barbaric to me.
If you saw a breast specimen on the operating room table, it would look like skin and fat. And so if you replace skin and fat with skin and fat, then you're going to have something that is most breast-like. So it's not skin, fat, and muscle. And the muscle that you use and sacrifice to reconstruct the breast atrophies and is just gone. So I just philosophically and otherwise just don't believe in using muscle to reconstruct the breast, and I don't use it.
The thought of not having any foreign substance in my body at all, of it being my own tissue, of not having the pain, of not having to deal down the road with another redoing of my implants when these possibly would fail, because, breast implants, to my understanding, are not a lifetime thing. They do wear out. So all of it just was amazing to me, blew my mind away.
After mastectomy, a woman has a right to breast reconstruction and any sort of surgery or treatment related to complications associated with breast cancer and mastectomy. And mastectomy can also mean lumpectomy, which is also called partial mastectomy. So if someone has a biopsy, a lumpectomy, mastectomy, and they have asymmetry issues, the insurance company is responsible for covering the asymmetry correction for the patient.
Your health insurance, as of 1998, is required to pay for it. Feminists fought very hard in the 90s especially to get breast reconstruction covered as a right for every woman who undergoes mastectomy. That doesn't mean you have to have it, but it should be covered, and it shouldn't be considered a cosmetic operation that is frivolous and all of that.
It's my body. This is my self-image. When I look in the mirror, I still want to feel like a beautiful woman. I still want to feel like I have my body. And every woman is entitled to that without being made to feel like, oh, this is a frivolous decision or it's just cosmetic. It's not just cosmetic.
I just knew that I had to find a woman to help me through this, and to relieve me of those awful feelings of being a monster.
So we have a group called Bosom Buddies, and it's basically patients supporting patients, whether it's what they're going through, tips on how to get through surgery, all that sort of thing.
All her past patients get together and we talk to one another and we celebrate our bodies, and if there's a new patient coming in and they need someone to talk to. In fact, just last week I was on the phone with a new patient and I was telling her all the little things to do and not to do, because I was sort of a bad patient when it came to recovery.
There's a day in October called Breast Reconstruction Awareness Day, Bra Day, just to raise awareness about breast reconstruction. In the United States, 70% of people who undergo mastectomy are either not offered or they don't get breast reconstruction. I think that's fine when they don't want it, but sometimes it's just not offered to them.
Bra Day USA is a nonprofit organization through the American Society of Plastic Surgery. And the idea is to bring focus to breast reconstruction awareness and all of the options and a woman's right to choose her own reconstruction journey. And we fully support that. So last year, and we hope every year from now on, we're going to host a Bra Day, bra decorating fundraiser in the office.
I had always thought it would be so fun to have a decorated bra type of event. This year, we ordered all these bras and all these fun things that you could decorate bras with, where people could come and decorate a bra, enter it in the contest, or they could take it home with them, or both. I want a woman to feel comfortable in her skin. I want her to feel like her true self she's inhabiting who she is, not what I want her to be or what you might think is what she should be, but what is appropriate for her. And sometimes people will come to me and say, so what should I do? I trust your judgment. And my response to that is, I need you to look inside your heart and your soul and yourself and figure out who you are and what is right for you.
You need someone to sit down with you and say, this is what your options are, and really tell you not just what the surgeon sitting in front of you can do, but perhaps what someone else can do. I think it's important to give people all of the information so they can make the best decision for their body.
Do your research.
It's your body. Know what your choices are.
Don't take no for an answer, and don't settle.
If you don't have the information to go by, how are you going to choose something that you feel satisfied with, even no matter how uncomfortable it is?
I so understand women being in that position of being diagnosed with cancer and just trusting what the doctor's telling them, because you don't know what else to do. You're scared to death.
Interview doctors. Don't just take because he's a plastic surgeon and he did the implants for someone and they are perfect with it, or good with it, or happy with it. It doesn't mean that it's going to work the same way for you.
Even being a nurse, right? You're thinking, well, you should know everything. You should know everything that's out there. No, you don't know, even as a healthcare professional.
I think it's important for women to try to educate themselves when they're not dealing with the diagnosis. You know, hopefully they'll never have to use that information, but have it in your hip pocket, just so that, just in case either you or a loved one is dealing with a situation where you have something to guide you, that you already sort of remember up here, oh, I remember reading about that, let me ask a question about that.
You have to have a sense of yourself and to know your own voice. And I had, from the very beginning, I had a voice and a sense of confidence about being healthy. From the very beginning, I saw myself as healthy.
You do get better and you do feel better, and I feel the best I felt in 5 years, and I really feel like me again. And 5 years is it's a long time, but it's not the end of the world. It's, I've still had a lot of good living in between.
Everyone should just be really careful about the choices they make. And, treat your body as a shrine, because it's the only one you have.